Look at Abidjan. It's the economic engine of Côte d'Ivoire, a sprawling city defined by modern high-rises, paved highways, and dense infrastructure. But step away from the commercial center and into the clinics serving the city's low-income and migrant neighborhoods, and a severe health divide appears. Nationwide, 480 mothers die for every 100,000 live births. It is one of the starkest maternal mortality crises on the continent. A primary driver of these deaths, and a leading cause of premature and low-weight births, is maternal anemia. This is a condition where a lack of healthy red blood cells reduces oxygen flow to the body's organs, and it persists right inside the borders of the country's wealthiest urban hub. A soaring national GDP does not automatically guarantee survival for a country's most vulnerable mothers. This chart shows data from the Human Rights Measurement Initiative, evaluating how well countries perform on human rights metrics relative to their wealth. Based on its current income level, Ivory Coast is only fulfilling 56.2% of its expected obligations for the overall right to health. When isolating reproductive health care specifically, that fulfillment metric drops sharply to just 26.6% of what the nation has the resources to achieve. A major reason for this shortfall is staffing. Across the entire population, there are only 2.2 midwives available for every 10,000 people. Because the available resources don't match the reality on the ground, citizens are forced to navigate a medical gauntlet that begins the exact moment they are born. If a child survives birth, the immediate threat shifts to their environment. Out of every 1,000 infants born here, 54 will not survive their first year. The absolute leading cause of mortality and hospitalization among these children is malaria. The disease is endemic year-round, but hits a violent peak during the wet, muddy months of the rainy season when mosquitoes breed rapidly. To reduce these childhood deaths, the frontline defense has historically relied on increasing the use of insecticide-treated mosquito nets in family homes. But mosquitoes are only half the battle. Over 10% of the country experiences food insecurity. Malnutrition weakens a child's immune response, making them far more susceptible to severe infection when a mosquito actually bites. Early survival depends heavily on navigating this deadly overlap, a highly infectious environmental disease striking a population with severe nutritional deficits. In 2024, the strategy for childhood health underwent a massive shift. The country received its first doses of the newly developed R21 malaria vaccine. The initial rollout targeted 250,000 vulnerable children, from newborns up to 23 months old, distributed across 16 different regions. This intervention is the result of a massive international collaboration between the Serum Institute of India, the world's largest vaccine maker, and researchers at Oxford University. With these doses, the medical system is finally able to move away from relying solely on passive prevention, like netting, and toward active, systemic immunization. As those children reach young adulthood, they face a different set of risks. While an estimated 400,000 Ivorians currently live with HIV, a newer, largely hidden epidemic is rapidly targeting the youth. It centers around a drug sold under the brand name Tramaking. It's a cheap, highly addictive opioid imported from pharmaceutical manufacturers in India. This chart shows the chemical breakdown of the street drug locals call 225. It mixes tapentadol, a narcotic pain reliever, and carisoprodol, a muscle relaxant. Combining an opiate and a muscle relaxant suppresses the central nervous system, frequently causing severe convulsions, respiratory failure, and death. The lethality of these overdoses is magnified by a massive shortage in emergency care. As of 2019, the country had only 0.016 physicians for every 1,000 people. Without doctors to administer overdose-reversing drugs or provide emergency respiratory support, foreign pharmaceutical exploitation thrives in the gaps of the medical infrastructure. This map shows the footprint of Ivory Coast's public health sector. Nationwide, there are fewer than 1,800 total medical facilities. While cities like Abidjan have large centralized hospitals, millions of people live in remote agricultural communities and forest villages far away from any clinical care. This sheer lack of physical infrastructure is the root cause of the crises we've seen. It is why pregnant mothers cannot find midwives, and why sudden drug overdoses go untreated. When the hospital system is this fragmented, highly treatable and preventable ailments frequently result in fatal outcomes. Yet, despite these severe vulnerabilities, measurable progress in infrastructure expansion is happening at the macro level. The government's National Development Plan, launched to build up the economy, has led to steady drops in national food insecurity, slowly closing the nutritional gaps that leave children exposed to disease. There are also massive cultural shifts underway to protect women. The rate of female genital mutilation is actively trending downward, with nearly 80% of the population now opposing the practice. And the historic rollout of the R21 vaccine is actively immunizing the next generation against endemic threats before they even begin to walk. A growing GDP will not cure these systemic issues on its own. But by shifting from reactive crisis management to building a resilient, fully staffed medical infrastructure, Ivory Coast is slowly closing the gap between its economic potential and its citizens' fundamental right to health.